Good morning, Mr. and Mrs. Henderson. Today we're here to talk about Frederick and his Duchenne muscular dystrophy. Here I'm joined with my team. It's myself, Dr. Cortez, Dr. Ruesga, and Dr. Yu.
As for Frederick's patient history information, we have his full name, Frederick Leslie Henderson, his gender, male. He was born on December 22nd of 2021. His weight is 27. His height is 35 inches. For his history, Frederick was visited or has visited the doctor 4 times in the last 6 months for his lack of average development. His record shows abnormalities in his walk, because he walks on his toes, his height, his weight, his speech and learning, and he has scoliosis. Frederick's mother is also a carrier, or we suppose she is a carrier because her uncle has Duchenne muscular dystrophy.
And now onto the background of the Duchenne muscular dystrophy.
Duchenne muscular dystrophy is caused by a genetic mutation in the dystrophy gene, which works to connect the muscle cells to stabilize the muscular structure. 70% of people who have Duchenne muscular dystrophy inherit it, while 30% of it receive it from the mutation.
Okay, so pattern of inheritance. Duchenne muscular dystrophy is a typical recessive sex-linked disease that mainly affects boys. They are inherited by the maternal, the mom, which is received by the X chromosome with a mutated dystrophin gene.
The symptoms are frequent falling, which is just falling randomly. This uh this usually happens once per year for a normal person, but can happen more than 2 times for a person with this disease. They have difficulty getting up from either sitting down or laying down. They have difficulty running or jumping. They have the waddling gait, which is kind of which is upper body movement kind of exaggerated, like waddling like a duck. You see walking on toes. This is to compensate for the weakened quadricep muscles. You see large calf muscles, which is due to the fat. You have muscle pain, stiffness, learning disabilities, most commonly dyslexia and growth hormone deficiency.
As my other doctors added before me, um, this disease is a genetic disorder, and this one occurs on the X chromosome. With that being said, males are more affected than females because of the fact that it is recessive. With this knowledge, females can be carriers of this disease, while males, if they have the recessive trait, they do have the disease. So this disease is caused by muscle degeneration and weakness because of a dystrophin that is not in the muscle cells, so it's not keeping the cells intact. So this means that the people who have the disease aren't going to be as strong, and they won't be able their muscles aren't suitable for life, and they're not really sustainable, which is why the people with this disease don't live live as long. With that being said, some things that you guys should do, since we know that Frederick has the disease, is we should look into muscle biopsy, aquatic therapy, and or glucocorticoid therapy. And we should find places where we can find these treatments for Frederick, because um, if we want to expand his life and make him live longer, it's very important that he does all of these things, or at least some of them, so that he's able to live longer and his muscles are able to stand.
Yeah. Visuals and diagrams. So in this pedigree, how it works is the male, which is the dad, has an X and Y chromosome, and the female, who is the mother, has two X pair of chromosomes. And the female, the mother, has a mutated dystrophin gene, which is then transferred to the child who is now affected. If the other children, the daughter, for example, with the blue highlighted, they have the dystrophin mutated gene, but is not actually affected, but is now a carrier just like the mother. So the daughter who has the affected mutated gene is now a carrier just like the mother. The other two children who are not affected does not have the affected gene because they got the unaffected X gene from both parents.
Here are some recommendations for treatments for your child. Our first one is genetic testing. A reason for doing testing is that it confirms the diagnosis of Duchenne muscular dystrophy. It identifies specific mutations in the gene. Being able to identify the genes allows families to plan for treatments and lowers the risk of passing the condition. Some key points about that is just really to understand the specific treatments you can get if you have this disease and being able to clarify if you even have the disease.
Okay. So in muscle biopsy involves removing a small sample of muscle tissues through a small cut. The small sample of muscle tissue is then looked under a microscope and is tested for proteins. The proteins analyzed help to determine which type of dystrophy you have. So key point is that if a person were to have Duchenne muscle dystrophy or Becker muscle dystrophy, they will have too little of the protein dystrophin in their muscles, which is usually altered in size.
A child diagnosed with Duchenne muscular dystrophy, aquatic therapy could be a very helpful way to regrow their muscular activity. Swimming in a pool is not only extremely fun for a child, but it helps strengthen their body without overdoing and overworking their body. This key point to pursue aquatic therapy is because the water can rejuvenate the muscles and prolong a child's life while not overexhausting them. And swimming is very tempting for a child. So it is both helpful and stimulating.
Along with what Dr. Yu said about muscle biopsy and what Dr. Rezga said about aquatic therapy, another option is glucocorticoid therapy. And this kind of therapy utilizes medications like steroids, and this is to reduce inflammation in the muscles, and especially in people with Duchenne muscular dystrophy, they have a lot of inflammation in their muscles. As we said before, these muscles aren't strong, and because of them not having dystrophin and they're not intact, this inflammation is gonna help. Um, this inflammation is gonna be bothering them. So then steroids come and reduce this inflammation. It helps and it makes them feel more relieved. Um, this is good, but another key point about this is that if too many steroids are administered, then there will be side effects because steroids are not used are not always positive. So if we use them too much, then the negatives will outweigh the positive, and it will hurt Frederick more than it will actually help him.
Questions and answers. One question that a patient might have, and we have an answer for you, is there any cure for Duchenne muscular dystrophy? And if so, what is it and what actions need to be taken? To answer that, there is no cure for Duchenne muscular dystrophy, but there are many therapies that a patient could do to prolong their life as much as possible.
Connecting back to what Dr. Rezga said, yes, unfortunately, there are no cures as of right now for Duchenne muscular dystrophy. However, we will continue to be doing things like aquatic therapy and glucocorticoid therapy and muscle biopsy in order to hopefully maximize Frederick's life. This typically will happen, their lifespan when people have this disease is typically from their teenage years to their young adult years in their 20s. So we'll be doing what we can to help him make it there.
Okay, so a third question you might have is what can be done for the remainder of the patient's life that will provide comfort until their time comes. So you can still keep on doing the therapy as stated and to just do a lot of muscle exercises, cardiac care, respiratory care, and steroid.
If you have any more questions, you can check out some professional sources. This involves Vinogopal's articles and books. Cleveland Clinic, they have awesome resources, and Muscular Dystrophy Association.
Thank you, Mr. and Mrs. Henderson, for coming once again. We hope to see Frederick prosper. Although he does have this disease, we will help him to um, reach his full potential and help him really live life to the fullest. With that being said, thank you for supporting him and just thank you for giving us your time and have a good afternoon.